So today within healthcare, our med token, what that does, it de-identifies that. It doesn't give the providers upstream the ability to be able to see that. All it does, it provides your name, your credit card number, and the amount that you're purchasing. As long as there's a standard that's in place that is provided at the best way to be able to privatize or secure data is what's to be used.
Good morning, afternoon, or night, depending on where you're at. I am Nick Mulholland, president of Tech-Gofer and your host of Get in the Hole with Tech-Gofer. Excited today for my guest, Mr. Jon Lee from Fluid Financial. Very, very interesting things going on in healthcare compliance and merchant processing, and this guy is the expert. So, John, thank you for joining us.
Yeah, of course. Happy to be here.
Glad, yeah. So, as I think that everybody knows, we start with, what are you drinking? So, John, what are we drinking?
So I'm drinking a little bit of wine. As you can see behind me, I've got a bunch of bottles of wine and some bourbon hanging on the wall. All about the wine. Yeah, Napa, California, Italy. I've got a couple hundred bottles in my collection right now. Yeah, so there's no shortage.
There you go. Do you lean more towards whites or reds or kind of whatever you're feeling?
Yeah, it really depends on the weather or what I'm, eating, drinking, whatever it may be. But generally, it's more red than it is white. But in the summer, when it's hot, you got to get that white. You can't do that. It's just too heavy for you. Yeah,
I'm with you. As I've traveled fairly extensively, I've always found it interesting based upon weather, what the people there drink, right? So, like, you go to Ireland, it's kind of cold, it's rainy, people are drinking Guinness and they're drinking whiskeys. Then you go to, like, Turkey or, Italy is a good example. It's all lighter liqueurs and that sort of thing. So, that matters. I have a green tea vodka soda with a little lemon. It's pretty tasty.
Wow, sounds super healthy. Alcohol is healthy, right?
Yeah. I mean, as healthy as it's going to get, right?
Yeah, there you go.
Awesome. Well, let's jump into it. So, in our conversations, you kind of gave me a lot about your background. I think our listeners, viewers would love to understand. You're over 30 years in merchant processing technology and whatnot. So tell us about your background, if you don't mind.
Yeah, so it's been 30 plus years, unfortunately, for me to say that. I started out quite some time ago at the beginning of merchant processing. Generally, when there were these really small credit card terminals and they were detached from the point of sale, and you were able to kind of remotely do your payments. So it was this whole fragmented type of industry. I owned a company called Terminal Exchange. And what we would do is we would go to Europe, whose technology within payments is about 12 to 15 years ahead of the United States. And I would buy hundreds of thousands of these credit card terminals that they were bringing back because they bring it back to their banks because they were going to the EU. So there were multiple iterations for the banks to be able to upgrade their server banks as well as their equipment to be able to communicate to the merchants. So I would bring it back to the United States, refurbish it, and then push it out to market. So we became the number one provider of refurbished credit card terminals in the United States. I think at our max output, we were doing about 212,000 a month. And we were doing extremely well. So by understanding that part of the business, it kind of lent itself to the other side, which there's the hard side, which is the equipment, and then the soft side, which is the actual merchant processing. So through my travels in Europe, I did a lot of consultation with a bunch of the banks in Germany, Turkey, Ireland, England. I name one of the countries over in the European Union that was going to the EU. I was dealing with them on a kind of a semi-annual basis. So the advantage for that was for me to be able to identify the technology that they were trying to deploy in Europe, and be ahead of the curve in the United States. So brought all the terminals in, understood the technologies, saw what they were doing, and we sold the credit card terminal company and opened up the traditional merchant processing where you would go out and you would speak to the merchant, any type of retail establishment, hospitality, any type of business, and sell the merchant processing. You provide them with the credit card terminal and they were good to go, right? It's like, here you go, you're up, you're running. As technology started to evolve within payments, I was able to stay ahead of that because I understood what it was like within Europe. We started to see this whole compression of of margins because everybody and their grandmother was getting involved in payments. It's the best way to be able to make money. It's recurring on monthly, to be able to make a recurring type of salary. And our margins started up here and started to go down. So we evolved into point of sale. You go to a grocery store and they have that line item of what it is for each grocery piece that you have. We started to deploy that into grocery stores, really any type of establishment all throughout the United States. So that was kind of the emergence of the push into technology for us. And then in order for you to be able to use that point of sale and to make it seamless, we started integrating in a gateway that we developed. So the gateway would be the provider for the payments wrapped into the point of sale, and it's this seamless type of solution. Cool, right? So we were doing really well. Margins started to go back up. We got to about 3,200 merchants in our portfolio, and we were acquired by a larger company called i3 Verticals. i3 Verticals, as of today, is still traded on the NASDAQ and has a market cap of, I believe, over $1 trillion a year. We were one of the original 7, and we set out to have this strategy to be able to take away a lot of the merchant processing business from the individuals that were kind of not doing well with the business. Like everybody, when you say, what do you do? Oh, I'm in merchant processing. It's kind of that dirty word, right? Yeah, again, it's not that everybody doesn't, not everybody is
for sure.
as ethical in the business as some people. So we said, how are we going to do this and what are we going to do in order to capitalize on the technology? So we got very verticalized. We went into healthcare, education, public utilities, as well as municipality and governments. And we acquired 5 other companies and then wrapped our payments into that. Fast forward, PCI and DSS. If you want to touch on that, we can get on that now, or we can move on to that.
Yeah, let's circle back. Let's finish with your background, and then we'll.
So my background, yes. So we were doing that with i3. I was executive vice president for 7 years. We took the company public in 2015. I stayed on board until 2019. I was part of 32 acquisitions of other organizations, as well as 17 portfolios. Had a bunch of shares in i3 and said, you know what? I'm tired of traveling from Sunday to Friday. I'm done. So I cashed in half my chips and retired, but stayed connected with technology within Europe with a lot of people that I was currently engaged with, and sat on the sidelines and started doing some investing. And fast forward to today, Fluid Financial. I'm CEO, president of Fluid Financial, as well as Fluid Tech, which is the overall holding company of Fluid Financial. And we're doing great things within payments now today.
Yeah, and I think some of our listeners, viewers might be wondering, why would Tech-Gofer be bringing on a merchant processing expert? Well, you guys are now only merchant processing partner that we've selected due to some of the changes that have happened recently with the Cures Act and just in healthcare specifically. Can you tell us a little bit about some of those changes and whatnot before we jump into how your new product is solving the problem?
Yeah, definitely. So as everybody knows, there's HIPAA compliance. So those are the standards within healthcare. And they kind of govern everything that happens on a government level that pushes the Affordable Care Act to give everybody the ability to not only get their health insurance, but also have the ability to have that health information be private. So everything is kind of geared around that privatization of patient data and how that data gets handled within HIPAA. Back in 2009, HIPAA started to emerge, and what the government did is they had kind of a carve out for payments. The carve out was PCI DSS, which was the latest variation of payments at that time. So they said, we're going to carve that out. As long as you're PCI DSS compliant, you're good within payments, and you need to worry about the other side of your business for the handling of EFI, or the electronic payment health information. Fast forward to 2015 is when they came out with Cures, which had more guidelines, very specific to the handling of that data, and then the oversight from ONC, HHS, AHA, and all of the other associations, acronyms that are associated with healthcare today, right? So they now have drilled down and have more stringent regulation for the handling of that data. What we've identified within HIPAA as well as within Cures is that the way that the patient data is being handled falls within HIPAA compliance as well as Cures compliance but not within payments. So we've uncovered that and we've said, hey, what can we do with our technologies and our tech stack to be able to fill that void in both areas? So if you fill it within HIPAA, you're filling that area within cures and vice versa. So they kind of all go together. One's more regulatory and compliance than the other being the actual law itself.
So let's jump into the Med Plus. So you've got a blockchain on the back end, and you know what? Why don't you explain it versus me?
Yes. So what we've done is we've created a gateway that provides the ability to de-identify any type of data to be pushed upstream. So what does that mean, right? Everybody's like, well, so what does that mean? So that means that at the point of purchase today, if you dip or tap your credit card with that little chip, depending on what data that specific retailer or that payments company wants to see is what they flow upstream. So it could be your name, address, phone number, email address, what you've purchased, how much you've purchased, line items of purchases and things of that nature. So they don't really tell you how much data they're actually able to get off of that chip, but it's as much data. The data that's provided is as smart as the actual piece of equipment that's able to provide that data, right? So point of sale today is just like a regular computer. A regular computer has thousands of megabytes of information in. So if you're using a point of sale, it's able to pull just that much data, but you need to say, we want this specific information, right? So today within healthcare, our Med token, what that does, it de-identifies that. It doesn't give the providers upstream the ability to be able to see that. All it does, it provides your name, your credit card number, and the amount that you're purchasing.
You know, based upon some of the changes that you mentioned, I mean, other merchant processors right now that are openly providing this information and not withholding it, that is actually out of compliance. Is that correct?
That's at both HIPAA compliance as well as Cures Act compliance, and I'll explain that. So within HIPAA, the standard or the carve out was PCI DSS, and everybody within healthcare, that's the standard, right? But within HIPAA, as long as there's a standard that's in place that is provided at the best way to be able to privatize or secure data is what's to be used. So PCI DSS, up until we've created our solution, was the gold standard within payments, right? So we've created this token that de-identifies that data. So now we have that overlay of PCI DSS, and now there's a new standard within payments. So if you don't use that standard, then you don't fall within compliance or don't meet the regulations.
And correct me if I'm wrong, this is patent pending as well as from a legality perspective. We have a dear friend, Max, who's a previous lawyer, is a lawyer, and has had numerous lawyers really look into this. So correct me if I'm wrong, there is like legal folks that are going to actually give statements stating that this is, everybody's not in compliance anymore.
Yeah, so Mad Max.
Yeah.
He was an ex-prosecutor for Janorino. He knows the law really well. And what he had done is he identified this loophole that we're currently experiencing today. And we vetted it with, it's a round number, but we vetted it with 40 attorneys. So 40 attorneys that are very specific within the healthcare space that know HIPAA compliance and Cures Act compliance. And they've agreed that the solution that we've provided is the latest solution to provide the privatization of that data within HIPAA as well as Cures.
Not to super scare everybody out there, but if you were a healthcare provider of any kind and you were to get, the government audits you and you are found guilty of not being up to these compliances, what are the fines? Like what is realistic that's out there?
Yeah, so I love these questions because it actually falls in line with the direction that this will be going in. So as of July 31st of this year, the ONC is going to start mandating and putting or enforcing the Cures Act. So exactly what does that mean? That means that any organization that's found to not protect the data to the latest technology will de-identify that data, will be fined between $0 and $1 million per transaction. Per transaction. Yeah, it's a big number.
Are they already, I was going to say, are they already like going out and starting to audit now that it sounds like the government understand or knows that this new technology exists. How hard are they really going to start enforcing this? I mean, is this something that
Yeah, they're getting out there. So they're starting to enforce fines of about $100,000. It's not per transaction as of right now, but hospital organizations and larger organizations are starting to feel the ONC coming down and levying these fines. Yeah. I mean, so that's bad in itself. But the other side to what they can enforce is pulling 25 up to 25% of Medicaid and Medicare from the federal government. And, as everybody knows in healthcare, that's kind of your foundation to be able to run your business.
Sure.
And so you pull that out, and it's almost like pulling the rug out from underneath you.
I don't think crazy go into more details. I think you've done a fantastic job with the overview. Where can people come to learn more about this?
Yeah, so there's multiple different areas where they can come to understand what we do. So right now, they can jump on our website, fluidtech.ai. And it gives a full rundown of Med Token as well as ICE Token, but that's more towards general consumer usage. But Med Token is what we're using to be compliant within the medical space.
Okay. And obviously, as I mentioned, we are a partner, so anybody can reach out to Tech-Gofer as well. We can certainly connect you with Jon. If you really want to nerd out, Jon, he'll be able to tell you all the specifics as the CEO and guy who built this solution. So that was really cool. I'm just more curious as far as the future of healthcare payments. What might be next in the next 5 years? I mean, things are changing so fast.
Yeah, so as of right now, what we have working is Med Token, but we also have a bunch of other things that we're working on within our tech stack to be able to enhance that as well. So what we're trying to do is we're trying to transcend what normal payments are today within, say, the hospital organizations. Down the road, definitely for the medical vertical, would be dual payments. Dual payments is actually passing the cost of the credit card processing onto the patient or the consumer. What that does, by passing the burden on to the patient or the consumer, it frees up all of that money that they're currently paying for their processing. And just for an example, we have one group of clinics, there's 27 in total. They do about $100 million a year in credit card processing. We save them close to $4 million a year just by transferring them over to dual payments.
Wow.
Yeah.
Is that a payment solution that sounds like that's available, or is that still in a testing type of phase?
Yeah, that's available today, but it's been very slow on the uptick because a lot of the payment providers haven't really had that conversation with these healthcare organizations as of yet.
Yeah. So I'm just curious, as you mentioned that the data that credit cards that are processing today, they're providing more information that's really necessary to provide the transaction. So if I'm running a Chase card with a chip and now Chase is not receiving that name, the amount, but they're not getting what it is, are they going to be able to categorize it for all the points that I think a lot of people worry about when they're using their credit cards?
Yeah, you'll be able to categorize it because it's the credit card number and the amount that provides the ability for them to be able to give your points or whatever, get a cash back, whatever that may be.
So they'll know from a merchant that's categorized, so that's not a concern at all.
That's not a concern now.
I've got a lot of points and I don't want to lose them. So
yeah, I have a lot of points too. Yeah, I don't like to lose mine either. I like using them, but not losing them, right?
Exactly. Awesome. Well, again, anybody out there that has questions, reach out to Tech-Gofer. We're happy to connect you with Jon, certainly Fluid Financial, their website. As we always kind of finish, a little bit of on a golf end, if you will. What is your favorite round of golf you've ever played and why?
Yeah, that's a tough one because I really don't play a lot of golf.
Yeah.
I think my favorite round of golf, I would say, was at Doral on the Silver Course. And I say it was my favorite because I brought 50 balls with me and I walked home with 10. So I won.
All right. You got your money's worth. You left with a few balls. So you and Max, really, when you guys are going to go play, you got to bring like a lot of balls.
Oh yeah, I go to the local range and just start picking balls off the ground.
Yeah, I got you. My favorite round, just because it's a cool course, is definitely Chambers Bay. It's just in such a unique place in Seattle. You have to walk. It's a links course. Beautiful. It's well maintained. That was a really interesting, cool, fun day. Memorable. I mean, my favorite round has to be the one where I had an albatross on the 18th hole, par 5, 181's out, which for anybody that's out there listening that has heard this 3 or 4 times, it's just going to continue to be a golf story that I talk about because it's so rare and hard to get. But yeah, well, Well, John, again, appreciate the time. Thank you for walking us through a lot of those changes, which is highly complex. I think you did a tremendous job kind of narrowing it down for us. And again, for any of those viewers out there, if you need help, contact us. We're here to help you. We've got good resources like John. Follow us, like us, comment, and otherwise we will see you next time on Getting the Whole. John, thanks again.
Yeah, of course. Thank you for having me.